Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about population health and some home-based services St. Tammany Health System offers to help the health of our population. We're going to start this morning with Dr. Michael Hill, Vice President of Quality and Utilization Management. Dr. Hill, welcome to the show.
Good morning. It's great to be here again.
I'm excited to have you here again and to have you here in your official capacity as Vice President of Quality and Utilization Management. Because I feel like for the last 2 years, every time I have you on the show, we are talking from your medical specialty of infectious disease, and we are talking about COVID. And I'm really excited today we're not talking about COVID.
I am too. This is a lot more fun than COVID.
Absolutely. And quality and utilization management, and a term that I used at the beginning of the show, population health, those are all some healthcare industry terms that we throw around rather casually, and you really spend all of your time in when you're not fighting COVID.
Right.
And I think if you can start off just defining a little bit about what population health means, that's going to help our audience know what's important about that for them.
Sure. So really at St. Tammany Health System, we're just not a hospital anymore. We really are a health system. We want to get into the community and promote wellness and promote people transitioning from the hospital to the home and getting the best care they possibly can. And so we have several initiatives in population health. One of them is improving the health and well-being of our community from birth all the way into the elderly. And I think that we have a great opportunity to take a healthy community and make it even healthier and avoid situations where people get in the hospital that might be avoidable. And so that's everything from cancer screenings to watching your cholesterol, to not smoking, to doing watching your weight, exercise, all the things that we know to be good for your health.
Well, to me, that's what's interesting about it. In healthcare today, we have recognized as an industry that all of those things that we know are good for us don't happen by themselves, and that we need management and programs and clinical care that focuses on the things you just mentioned. You know, population health is achieved through early detection. It's achieved through wellness programs. It's achieved through recognizing that when someone is well enough to be discharged from the hospital, they're not back to normal, and that there are some transitional helps that our organization needs to give to its patients.
Absolutely. And it's important that we transition the patients in a safe, proper way. And one of the nice things about transitional care, home visits for example, is it allows us to go into the home and see what are the issues that the patient might be facing that the patient doesn't even realize or the family doesn't realize.
Now that's pretty fascinating, and I think it'll be interesting when our next guest, Gabby Silva, really dives into transitional care, because you're right, there are so many things in our lives that we just take for granted. This is my home, this is my yard, this is my vehicle, and this is my life the way my life is. But those are all places that can actually introduce risks for patients, or they can be impediments to patients' good health.
Right, and I think that's very important. And just going back for a minute, something you talked about earlier, about 20% of healthcare really is managed by the physician or in the hospital. 80% is outside of the traditional healthcare model, and that's what we're trying to touch on, is get to that other 80%.
And I think that's the funny thing about population health, is recognizing that it isn't just about a doctor's visit or a stay in the hospital or a surgery or other procedure. All of those things are important, but those things can be encompassed in that little 20% wedge that you mentioned.
Right.
That 80% is our lifestyle, it's our family, it's all of the things that contribute to our daily lives. Maybe we work in a dangerous job, or maybe we make lifestyle choices that are not healthy.
Right.
And all of those things contribute in that 80%.
Absolutely. And I think one of the other things that we've begun to look at are what we call social determinants of health, which are very important. And one of the things that we realize in older people is social isolation can be a real issue, and trying to deal with those issues and and even going out and making sure that somebody goes and visits the individual or the family so that they're not isolated, because that really does affect health care, mental well-being, and determines outcomes of a patient's health.
You know, that's two things that I'm hearing you talk about as you're describing population health, and one is there's a mental health component, and the other is that we have to get out into the community if we're going to be successful at improving the lives and health of our population.
Absolutely.
And I think St. Tammany Health System has invested in a program called Healthier Northshore and an asset called the Be Well Bus. And I think both of those are really good examples of our population health initiative.
Right. So, you know, population health is getting out in the community, promoting health screening, which the Be Well Bus does, taking health care to where you are, because not everybody has the transportation or the means to get into a health care system. And really making the community aware what services are available, and the fact that if you get cancer and detected in an early stage, that you're much more likely to have a cure or a successful outcome. So those are very important things. And one other thing I'd touch on is we talk about population health in the aggregate, but when it comes down to it, population health is really about taking care of the individual and individualizing care.
I love that, individualizing care, because we have a tendency to think, okay, here's how you take care of people. We just need them to quit smoking and get their screenings and come in once a year and everything will be fine. But for each person, it's not just about their physical health. It's about their emotional, social, and mental well-being. It's about their home life. And all of those factors are different for every individual.
Absolutely. And you need to tailor the programs that we bring to people based on what their needs are. And that's what individualizing care is all about.
And that's what population health is all about.
Absolutely.
So that is fantastic. Well, Dr. Hill, thank you so much for coming in, for talking about quality utilization management and population health instead of about COVID.
It's great to be here. Thank you,
We're
Melissa.
really glad you were here. Thank you.
Thanks.
You're watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about population health and home-based solutions for the health of our local community. We'll be right back.